Hi, my name is Dr. Netta Elbuluk, and I'm a board-certified dermatologist specializing in pigmentary disorders and skin of color. I'm the founding director of the USC Skin of Color and Pigmentary Disorders program and a professor of clinical dermatology at the USC Keck School of Medicine. During this video, I will be discussing vitiligo, a chronic autoimmune condition characterized by the loss of functional melanocytes, which are cells that produce melanin, resulting in depigmented patches of the skin. There are various tools available to assess disease severity in vitiligo, including but not limited to measures of disease activity, like the Vitiligo Disease Activity Score and Vitiligo Signs of Activity Score, as well as measures of disease extent, such as the Vitiligo European Task Force Assessment, the Vitiligo Extent Score, and the Vitiligo Area Scoring Index, or VASI. VASI is a clinician-reported quantitative tool. The Total Vitiligo Area Scoring Index, or T-VASI, will be the focus of this video, and Facial Vitiligo Area Scoring Index, or F-VASI, is discussed in another video in this series. Now, while T-VASI is not typically used in clinical practice, it is commonly used in clinical trials, so it's really crucial that we understand the tool better to understand our clinical data. Now, T-VASI is a validated tool used by clinicians to quantify the extent and severity of vitiligo across the body. Scores range from 0 to 100, where 100 indicates complete depigmentation of the body. When calculating T-VASI, the body is divided into 5 regions: the trunk, the hands, the upper extremities excluding hands, the feet, and lastly, the lower extremities excluding the feet. So for each region, 2 aspects are assessed: body surface area, or BSA, and level of depigmentation. BSA involvement is assessed to determine the extent to which a region is affected, and it's scored in hand units. So 1 hand unit is equal to the palm plus the volar surface of all the digits. That's approximately 1% of our total BSA. The level of depigmentation is then assessed to determine how much depigmentation is present for each region from one of the following percentages. So 0% referring to fully pigmented skin, and then it goes up to 10, 25, 50, 75, 90, or 100, referring to fully depigmented skin. So once you have BSA percent in hand units and percent of depigmentation, these values are then multiplied for each region, and you get the sum of all regions as the T-VASI score. So as I mentioned before, T-VASI is commonly used in clinical trials to measure treatment efficacy. Outcomes are typically reported as proportions of patients achieving certain percentage improvements from baseline. For example, T-VASI 50 and T-VASI 75, which indicate improvements from baseline of at least 50 or 75% respectively. The definition of clinically meaningful improvement may vary, but recent studies have supported that a 50% or greater reduction in T-VASI or T-VASI 50 is considered clinically meaningful. Now, to put this into perspective, if a patient has a baseline T-VASI score of 12 and then after treatment has a score of 6, this would be a 50% improvement, meaning that a T-VASI 50 was met. Let's walk through an example of how to score a T-VASI with a hypothetical patient. Starting with the patient's upper extremities, the affected area measures 4 hand units, meaning there's 4% BSA, and there's 100% depigmentation in this region. So for upper extremities, the VASI score for this region is 4. For the trunk, the patient has 6% BSA and 75% depigmentation, giving a VASI score of 4.5. For the lower extremities, 3% BSA and 50% depigmentation give a VASI score of 1.5. And finally, for the hands and feet, there was no BSA involvement and the depigmentation score was 0, which gives a VASI score of 0 for each region. By adding the VASI scores together for all the regions, the T-VASI score for this patient is 10. T-VASI scoring requires training, and it's sensitive and reliable. Validation studies have shown an acceptable intra- and inter-rater reliability, as well as accuracy of T-VASI as a measurement tool. This is essential for ensuring consistency across clinical trial sites. There are also extensions and variations of the tool, such as self-assessed VASI, essay VASI, a patient-reported outcome which is based on the VASI, and VASI 10%, which follows the same principles as T-VASI outlined during this video, but the level of depigmentation is assessed in even 10% intervals from 0 to 100%. In summary, T-VASI is a very important tool that can be used to measure vitiligo disease extent and monitor treatment response. Understanding how T-VASI is calculated is critical, as it can be extremely helpful when interpreting clinical trial results. To learn about F-VASI, the related tool specific to the face, please check out our other video in this series.